Hi everybody, in this next video we're going to demonstrate what's known as the ACL and or PCL drawer test for potential tearing and or rupturing of the anterior cruciate ligament or the posterior cruciate ligament in the knee. So to perform our drawer tests for the knee, for our ACL and PCL, we need to be quite cautious with the patient because they may be experiencing a lot of pain with these injuries. So we place one hand under the knee to support and across the side, one hand under the plantar of the foot, possibly under the heel, and we're going to softly and gently guide it up to approximately 45 degrees hip flexion with approximately 90-degree knee flexion. We're going to tell the patient that we're going to sit and brace our thigh across the lateral aspect of their foot to stabilise the lower foot. And then from here, using our index fingers, we clasp around the back of the knee across the popliteal fossa area, using our thumbs to pad up to find our tibial plateau. This gives us a firm control of the tibia itself. Now our ACL drawer test is an anterior pull tractioning along the line of the femur. And we don't need to pull hard because if we do, we may involve hip movement. It's a simple traction, just moving the tibia forward on the femur. And this is testing the integrity of the ACL ligament itself. A positive finding here would be pain on the ACL drawer movement. A positive finding for rupture would be free play of movement forwards. What can happen on occasion is the patient has hyperlaxative ligaments, and there might be a lot of play, so we may need to assess the well leg to compare one to the other. If they are the same, it's most likely okay. To test for our PCL, we use the same hold, this time pushing posteriorly, making sure we don't shove too far forwards so we're not driving pressure into the hip, and we're trying to posteriorize the tibia on the femur, testing the integrity of the PCL ligament itself. Similarly, pain indicated in the popliteal area can be an indication of tearing of the PCL, and or lax of movement with possibly no pain can indicate a rupture of the PCL, similarly to the ACL. So there we have it guys, a nice simple technique known as the anterior and or posterior drawer test for ligamental tearing and possible rupturing in the knee.